It's amazing to me how many times I've heard how effective an NTI can be for migraine, how effective an NTI can be for facial pain, how effective an NTI can be for chronic daily headache. But, my goodness, whatever you do, don't put an NTI in when there's primary joint pain or there's an internal derangement, because the NTI compresses joints. Well, it makes sense, doesn't it? After all, if you take a small piece of plastic and you put it in the front of the mouth, and then when the mouth mandible closes, it's going to fulcrum there, and if my shoulders are the joints, just like it would happen in an articulator, those condyles are going to go up and push on that disc and compress the joint. Makes perfect sense. Only problem is it doesn't happen. It defies the rules of physics and the anatomy and physiology of the joint for many reasons. Number one is that Isberg and Westerson have both shown that there is no immediate rotation, that there's translation and rotation, and as soon as you put something between the teeth, that condyle is down and forward just slightly, so that when we put an NTI in, that condyle's not up and back, but somewhat down and forward. Second of all, condyles don't compress joints, they're compressed. In other words, they don't move by themselves, they are moved by muscle. When you take an anterior midpoint stop like an NTI, what you do is you reduce muscle force. 75% anterior temporalis, 50% masseter. So there's no real compression occurring, not like there is when we have a full arch splint, allowing all of that muscle force. Finally, of course, is the fact that all the muscle force vectors in terms of direction are anterior. The masseter is anterior. The anterior temporalis is somewhat vertical, but somewhat anterior. And as a result, there's nothing that brings that condyle up and back. But come on, Barry, I've put in an NTI, and I know if people put an NTI, and 2 days later, the patient reported joint pain. And that absolutely can happen, just like it can happen with a full arch splint. And usually it happens because the therapeutic protocol wasn't followed. If there's too much vertical dimension in the appliance, this will absolutely occur.